This informational video will describe Natera's rare disease tests, including copy number analysis, whole exome sequencing, and whole genome sequencing. Early diagnosis of a rare genetic disease can be life-changing by guiding treatment decisions, opening access to clinical trials, and helping families make informed choices. Identifying a condition sooner also shortens the diagnostic journey and improves health outcomes. Although each rare disease affects only a small number of people, collectively it affects about 350 million people worldwide. About 80% of rare diseases are genetic. Natera's rare disease testing is designed to bring clarity by providing a genetic diagnosis that can help patients understand the progression of a disease, make treatment decisions, and assist in planning future pregnancies. When a healthcare provider is looking at a patient's personal and family history, there are certain features that may suggest a genetic cause. These may include neurodevelopmental disorders such as autism spectrum disorder, developmental delay, or cerebral palsy, epilepsy, birth differences like heart defects and multiple congenital anomalies, unexplained losses of function such as hearing, vision, or muscle strength, growth differences like a small head or microcephaly, low muscle tone or hypotonia, or asymmetrical growth like hemihypertrophy, or multiple unexplained medical problems occurring in the same person. Rare disease testing may also be appropriate when previous genetic tests, such as panels or microarrays, have not provided clear answers. Reaching a rare diagnosis can be challenging because of hard-to-detect symptoms, limited information, and difficulty accessing specialists. Be sure to share your full personal and family medical history with your healthcare provider or genetic counselor. Natera offers 3 types of rare disease tests: copy number analysis, which checks for larger pieces of DNA that are missing or extra; whole exome sequencing, which looks at the parts of DNA that make the instructions that tell the body how to work, called proteins; and whole genome sequencing, which looks at all parts of the DNA, including areas outside the protein coding regions that help control how genes work. All 3 tests are performed using whole genome sequencing technology, which allows for broader and more detailed results. This approach provides better coverage of important DNA regions and allows your provider to easily move to a different rare disease test if indicated without needing another sample. Testing is done on blood samples or cheek swabs, also called buccal swabs. Your healthcare provider or a genetic counselor will choose which rare disease test to order based on your personal and family medical history and previous test results. Insurance coverage may influence which test is selected. This test can only be ordered by a healthcare provider. Possible results include positive, negative, and variant of uncertain significance. Let's walk through these 3 result types. We will use our whole genome sequencing test results as our examples. A positive result means that a disease-causing difference has been found. A disease-causing difference in the DNA is called a pathogenic or likely pathogenic variant. In some cases, this finding may be enough to confirm a diagnosis for the underlying rare disease. In other cases, a second pathogenic variant may need to be identified before a diagnosis can be confirmed. Your report will describe the result and what it means. Patients should review their report with their healthcare provider to understand if the test confirmed a genetic diagnosis and what the next steps may be. A negative result means that the test didn't find any genetic differences linked to disease. This does not necessarily mean that there is no genetic cause for the rare disease. It may mean that the current technology cannot yet detect the underlying cause, or that the specific gene involved has not been identified. Even without a positive result, negative results can still provide valuable information by helping to rule out certain conditions and guide next steps in care. As scientific knowledge continues to grow, new information may be discovered later about genetic causes of disease. For our whole exome and genome sequencing tests, Natera offers one complementary reanalysis at least 12 months after the first test. Reanalysis means that the original test data can be reviewed to see if new information is available that might impact the initial results. A variant of uncertain significance, also referred to as a VUS, means that a difference in a gene was found, but it is not yet known whether that difference causes disease. A VUS is not typically used to make medical management or treatment decisions. Instead, care should be based on the patient's personal and family medical history. As scientific knowledge grows, new evidence may explain whether the VUS is disease-causing or harmless. If a healthcare provider would like to check whether the classification of a genetic variant has changed, they can contact the Natera team at least 6 months after reporting. Whole exome and genome sequencing can either be performed on just the patient or together with close relatives. Duo testing includes the patient and one close relative, such as a parent or a sibling. Trio testing includes the patient and two close relatives, typically both parents or one parent and a full or half sibling. Including relative samples can make the results easier to interpret. It helps show whether a genetic difference was inherited or new in the patient, also referred to as de novo. Including close relatives in the testing can reduce the number of variants of uncertain significance. When you have a genetic test, it looks for differences in your DNA that might explain a health problem. Sometimes the test can find other differences that are not related to why the test was done, but may point to a condition that doctors can treat, prevent, or watch for, which are called medically actionable secondary findings. For both the whole exome sequencing and genome sequencing tests, patients and participating relatives are automatically opted in to receive secondary findings. These may include conditions linked to an increased risk for certain cancers, heart disease, and other treatable or preventable disorders. Anyone providing a sample can choose to opt out of receiving secondary findings by marking this on the test order form. The secondary finding results will be on a separate report. Each person tested, including patients and their relatives, will receive their own secondary findings report. Before deciding on genetic testing, it's important to understand your rights and protections related to genetic information. Federal laws such as the Genetic Information Non-Discrimination Act, or GINA, restrict most health insurers and employers from discriminating based on genetic information. However, this does not apply to elective insurance policies such as life insurance, long-term care insurance, or disability insurance. Some states have their own laws that may give you extra protection. Your genetic test results are private health information. They are kept confidential and protected under both state and federal privacy laws. If you are interested in Natera's rare disease testing, the next step is to speak with your healthcare provider. Your provider will review the available testing options with you and complete the informed consent process, helping determine which test is most appropriate based on your personal and family medical history, insurance coverage, and other factors. Once the test order and samples are received at Natera, results are typically available in about 6 weeks. Results are sent directly to the ordering provider, who will review and discuss them with you. If you have more questions after speaking with your provider about your results, you may schedule a genetic information session with one of Natera's board-certified genetic counselors by going to naterasession.com. If you have additional questions about rare disease testing, please talk to your healthcare provider or consider a referral to a certified genetic counselor. To locate a genetic counselor near you, use the Find a Genetic Counselor tool at findageneticcounselor.nsgc.org or scan the QR code on your screen. A genetic counselor can discuss testing options in more detail, help you decide whether testing is right for you, or review your personal and family history. Thank you for taking the time to learn more about Natera's rare disease testing. This concludes the presentation.